Hi, my name is Dr. Holly Berndt. I am an internal medicine physician and I currently work with HMG in the Extensivist Clinic. This is National Family Caregivers Month, and this is a topic that is very near and dear to me because I take care of primarily older patients who have caregivers. Each year we recognize all caregivers, but we often don't talk about all of the challenges that they face. Family caregivers contribute on average 37 billion hours of care in the U.S. and there are $450 billion that are contributed to unpaid healthcare labor for those patients. I often become very concerned for my patients' caregivers as the burden of caregiving increases as the disease burden increases. Patients' family members become very weary as disease processes advance and as a patient's performance status progresses as well. A performance status is defined as how functional a patient is. And as a patient's functionality decreases, their dependence on their caregiver increases. Something that's very important for caregivers to consider as their loved one is declining is that there is often more help than they realize is available. Many caregivers will fail to realize that their physician can order home health for their loved one, which can give them additional people coming into the home and give them a little bit of respite when it comes to that day-to-day personal care for the patient. Home health can provide home health aides to come into the home to help give baths and sometimes to feed the patient or to change the patient. This is done on an intermittent basis. However, it is a degree of respite for that caregiver. Additionally, if the patient has a further decline, many caregivers don't want to consider the option, but hospice is a very good option. Many families are very hesitant to choose hospice because they feel that they are relinquishing control of the patient's care or that they are throwing in the towel and you're giving up on your loved one. But in many cases, it's actually doing a very positive thing for the patient because you're beginning to focus on their comfort as opposed to making them go to multiple doctor's visits or returning back and forth to the hospital. And it focuses primarily on their comfort, understanding that the medical issues that they have are not fixable any longer. And many people don't realize that hospice can come in even 6 months prior to the patient's death. A doctor just has to certify that they believe that the patient's life expectancy is 6 months or less, and oftentimes this doesn't happen. But as long as a hospice physician can certify that the patient is declining and it appears that their death will occur within 6 months, they can continue to be recertified for hospice services. So oftentimes, hospice is utilized too late in the game, and we often will bring it in only when the patient has a week or less left. And the patient doesn't get the full benefit of what hospice services can really provide. So I'm very passionate about making my patients and their families aware that this is a service that can come in early on and can give families lots of relief and take a lot of the burden of the patient's care off of the family member.